So guys, welcome. It's the second part of this MDCN series. So we're going to be talking on the examination proper, like what to expect and all of that. So the examination is usually on a national level. So this MDCN is going to choose a state in the country where the exam will be done, and everyone is going to travel to that state wherever it is, and you're going to have the exam most likely in teaching hospital that's in that state. So usually the CBT section of the exam will be done in a computer center. So you may have different centers will be distributed according to your numbers, and then they'll let you know what center you fall in. Then OSCE is usually everyone together in a particular hospital, usually a teaching hospital in that state. So yeah, you have to put that in mind. So the other thing I want to talk about is expenses. See, before you start writing these exams, you have to prepare and know that you're going to spend money for these exams. So try and, if you have to save or inform your parents or guardians ahead of time, because it's getting money. So from the registration to the tutorial, the registration for my set was I think about 130,000 naira. 130,000 naira. Then for EPIC registration again. So this 130,000 naira was for MDCN registration alone, like on the MDCN page. So you're still going to do EPIC registration in dollars. Then tutorials, if you think you want to go for them, but I advise that you go for them. Tutorials are going to pay for that. Then transportation too. Sometimes some people have to move to the place, the city or the state where they have this tutorials, have to book accommodation there, depending on what the situation is. Then also you have to transport yourself to the state where the examination is going to hold, because for instance for me, the examination I had was held in one of the northern states in the country, and then we're told that the road to that place was not good, kidnapping and all of that, so we didn't want to take the risk, at least some of us, but some people still went through by road and it was fine. Some of us didn't want to take the risk, so our parents just had to find money to book a flight ticket for us to travel there. So those are some of the things you have to put in mind for that. Then aside transportation, accommodation in the city also, you have to find a good place to stay. Concerning picking a place, be sure of where you're staying. Let it not be a place far from the city center or far from the hospital where you're going to have the exam, the OSCE especially, so that you don't have problems transporting yourself there. Then aside that, of course, feeding and any other extra expenses anyway. So put that in mind and prepare that you're going to spend some amount of money. So as you're spending the money, let it be genuine you to study, because that's a lot of money. But anyway, sorry about the noise. Okay, so the next thing I want to talk about is the exam day proper. So when you get to, it's advised that you should go some days before, maybe like 2 days before the fixed date of the exam. The fixed date of going, of course, you're going to get information from MDCN, so you keep tabs with them. Then go like 2 days so that you can rest, settle down in the city a bit. Then go and locate your CBT center before that day. Locate the hospital where it is, so that you can know how far it is from where you're living, so you don't have any issues that morning. We're told to come at 7 a.m. for both the CBT and the OSCE, and the officials were there at 7 a.m. So don't think that there's Nigerian or African time. They actually kept to time, and I was really impressed. I was like, wow, this is good. So yeah, we're there as early as you can. Transportation, if you have to book a driver to carry you, sometimes there are agents who specialize in all this what's it called, medical exam, they'll take you. I also worked with that, and it helped me, saved me a lot of stress. So at transportation, they'll transport you. Then accommodation, they can provide good accommodation for you, and the good thing is that they'll put you in mind, knowing that you're a medical doctor and you came here for an exam, so they'll put those things into considerations when they're choosing an accommodation for you, or when they're choosing transportation for you. So it helped, it saved a lot of stress and time also. So if you can afford it, just go for it. But if you can't, they just find a way to survive, because you gotta do this. Alright, so Aside that, so I advise that you go there so you know the place and get familiar with the place. Then the exam day, my dear, don't do overnight reading. Like try and read, just try and, if you want to do overnight read, that's up to you, but try and get a good sleep so that your brain can be calm. Because if you finish reading and your brain is scattered in the exam day, it doesn't make sense. So try and make sure that you get a good sleep so your brain can be calm to you, because it's going to be the tension and the stress, mental stress, there also can be an issue. So try and do that. Then I'm going to talk about the computer test. I've talked about coming early. Then sorry, before I come talk about the computer test, dress well, dress appropriately. For men, try and put on a tie. That's like an official, dress mode in Nigeria, especially for doctors, like for doctors, medical and doctors anyways. So put on a tie if you can. Just look as corporate and smart as you can be, especially for the OSCE days, because appearance is also a thing with the examiners. So then girls, ladies, dress moderately and decently. Don't expose any extra things. Don't wear excessive jewelries. Don't put heavy makeup. Make it as simple as your hair. Make sure you pack it neatly. If you have to even tie a scarf, tie a scarf. If your hair is all over the place, but everything should be moderate and decent. You should look presentable. Wear your covered shoes and all that. So that's also something. So that's that about dressing. Then I'll go back to the CBT exam. When you get there, listen to instructions. Be around other candidates. Don't be solo somewhere, because sometimes I've heard of them forgetting people, or like, so that you don't miss information. Maybe they say, let's go to this place. You're going with everyone, so nothing messes up your exams for you, so that no one is disqualified or anything. So be around other people, listen, be alert. Oh, they said you should do this, everyone do it. They said come on this time, come. Just don't get yourself into any problems, because you have other things to think about the exam, not any other things distracting you. So about the CBT, make sure that when you get in, try and sit down, relax and all that, and work with time. The CBT lasts for 3 hours. I think it was 180 minutes for 300 questions. So you have to see how to work with time, because before you know it, your time is gone. And reading the instructions properly. Don't make a mistake. Don't mistakenly lock yourself out, or mistakenly finish exams when you haven't finished reading questions. If you're not clear of something, just raise up your hand and ask any of the officials. They will attend to you. They were pretty nice, pretty open, and I was impressed about that too. So yeah, then read your questions also properly, because sometimes you see something, you say, oh, this is the answer, but read and know what they're asking you for. So read your questions properly, answer, make sure you click properly. Don't touch anything on the computer anyhow, because they said the computer, if you touch and then you can scatter the head of the computer, it's gonna be a problem. So try and avoid that. Then before that morning, if you can eat something, try and eat something if you can, just to have enough glucose so you won't be hypoglycemic. But they gave us food, actually not food, they gave us snacks like biscuit and water on the CBT day. On the SK day, they gave us bottled water, carbonated drink, soft drink, and biscuit also. So that's fair. At least they didn't leave us hanging. So yeah, that's that. So about the OSCE, yes, on both days, both the OSCE, CBT and OSCE, make sure you sign in and don't forget to sign out, because apparently if you don't sign out, it's like you didn't write the exam. So sign in and sign out after each day. Then for OSCE day, also get there early, way before time. Make sure you're well dressed. Go with your lab coat and at least your stethoscope. You can go with other instruments like pen torch, tape rule, sphygmomanometer. It's not really except if indicated, but then don't go with your pen, because they usually give you a pen, and they always say don't come with anything, but try and go with your stethoscope and your lab coat, because they did that to myself, and they said on CBT day, they were like, don't come with anything, just come with yourself, don't come with anything. They kept hammering it, and unfortunately some people took them word for word. went there with their lab coat and they didn't come with stethoscope, and they needed stethoscope to examine patients. They had staff going around to look for stethoscope. So I almost made a mistake. I was like, oh, they said we shouldn't come in anything. Let me drop my stethoscope to adjust my lab and just come with my lab coat. I was like, stethoscope. At least I'm just going. They said I should. If they say I shouldn't go in with it, I'm just going to drop it outside or somewhere. But it's safer because you can't start carrying yourself back to wherever you're coming from to go get your stethoscope and all of that. So, though I came with all my instruments to the exam, like the city state, but I dropped some in the room, like the accommodation where I stayed that morning. But I gratefully I went with my stethoscope, and of course I had to use, and I even went with tape. I'm so grateful because it was lower limb examination we had to do, and I needed a tape. Though they provided a tape, but they didn't provide stethoscope. So try and go with your stethoscope and your lab coat. Neat lab coat. Long sleeve lab coat is usually what's required in Nigeria and the US. So try and make sure your lab coats are long sleeved. Yeah, and not too hugging. You have to be moderate here. So yeah, basically that was that. So we didn't exactly start at 7, but they were there at 7 and they started calling us in at 7 because we went in our batches, especially for the OSCE. So put that in mind too. If you can eat so you don't pass out. Or at least eat the night before. So even if you don't eat that morning, to help you. Yeah. So I'm going to talk about some tips for the CBT exam. I think I talked a bit about it before, but I'm just going to just a bit more detail. I already talked about the fact that you shouldn't spend much time on any question, but make sure, try and look through all the questions, because if you spend some time on the questions you've seen, like maybe before going through all of them, there may be some questions like later that are easier, like you don't have to spend so much time, you just know the answer. So if you spend much time here, you won't be able to get it to see the easy one and get your mark. You get, and the time may finish before you get them. And try and go through all the questions so you can answer the easy ones, then come back and spend more time on the difficult ones. Then also I advise that you start with your picture test first, because they have just 50 questions, 50 picture tests, and I heard they carry more marks. And yeah, so just start with those ones first, then you cannot spend time on the other ones, and just try and at least try and answer more than 250 questions out of 300, or at least up to 280 questions, so that even the ones you're not sure of, at least you can cover up. But if you can't, just try and cover all the questions at least. Okay. Then so they also advise that try and end the exam and submit before it logs you out. So like maybe at least a minute or 2 minutes before, because you see the time, so maybe 2 minutes before it logs you out, try and submit yourself to avoid any losing out the whole thing. Then yes, about the OSCE, I already just said that it's stationed. So yes, listen to the simulators. The simulators are the people that are acting like patients. Listen to them. Apparently for me, I had been taught, like when they were teaching us, like I was hearing from people, and also how I studied, or like what they said, that don't listen to the simulators. That some simulators, apparently they were talking based on previous experiences. Like the simulators, some of them were not trained, so they'll just come and some of them can just be talking and wasting your time when you're asking them questions, and you won't be able to ask all the questions before the time is up, because examiners listen to what you are asking, not necessarily what the patient is saying. So I was trying to avoid that, and I kind of missed out some tips some of the patients were trying to give me. Apparently this time they had trained these patients, and they trained them to answer in a way that will guide you as the candidate on what to ask more, because those are some of the things that carried more marks in the marking scheme. Unfortunately, I didn't know that, because based on what I had been told, that don't spend time listening to what you just be asking all the necessary questions you need to ask based on your diagnosis or counseling or whatever it is. So it was later when we came out, we started like talking about that actually, and I realized, because when I was collecting for tuberculosis, I asked some questions for causes. When I asked about if he has been exposed to someone who had the same symptoms as tuberculosis, he said yes, that his uncle. So that was supposed to guide me, but gratefully I already knew the diagnosis was tuberculosis based on the question. So I asked all the questions necessary for tuberculosis. But it affected me in some other stations, where like there was a station about postpartum hemorrhage, and the woman kept saying she bled. When I asked questions relating to blood transfusion relating to bleeding. She said yes, because it's not everything they say yes for. There's some specific things they said yes for. So the ones they said yes for, I was supposed to ask more questions to get more information, because that's where the mark was. That was the focus of the case. But unfortunately, I was working based on what I had heard. I don't listen to what the patient says. Just be asking you questions, because some of them, they don't know what they're saying. So that's kind of it. But thank God for everything. So I'm saying it now that I think now they've changed their scheme of things. They are training their patients to answer appropriately. So when they answer, listen to what the patient is saying and kind of tilt your history or your counseling based on that. Then another tip for counseling, I don't know, I think, oh yeah, it was during when we're having the final revisions, the person that was doing the tutorial said that after our counseling we should always ask, because no matter that's what you're even supposed to do, but it looks so small, but do it, that ask that do you have any questions. That sometimes when you say do you have any questions, it helps you. Maybe if there's things you miss. Okay, for instance, when I was counseling for one of the stations, after I said everything I thought I was supposed to say, then I asked the woman, like, do you have any questions? Then she said yes. She started asking me questions based on the things I did not mention. So I quickly started answering her accordingly, and the examiner was marking for me. So sometimes you may not, because sometimes you don't know what they want. So you're just asking based on what you can think about and based on what the question is. But when, especially for counseling, when you're not asked, do you have any questions, and you listen to what the patient asks you, then say what the patient will answer the questions appropriately, so that means there are some things you miss that is a huge mark. That's what they're looking for. So that also helped me with one of the counseling stations. So yeah, and then just remember you're working with time, so there's no time to play around. Do everything quickly, so that you can finish as much as necessary, as much as possible within the time allotted, which is 5 minutes. And follow instructions. If they say stand up, just stand up. If they say sit down, just sit down. To avoid any issues, they can disqualify one. So just be careful about that. Another tip I want to give about the examiners is that you should make sure that you remember that the examiners are human beings. They have emotions too. So don't allow the scary face scare, because sometimes they can look very strict and all that. But in my batch, they were pretty relaxed. They were even the ones telling us that we should relax. We should not be so tense, and some of them won't talk with us. So but just try and relax, because tension can even make you forget what you know. So try and relax about that. Don't be too relaxed anyways, but smile. Even if they don't smile, but just smile all the same and listen to what they're saying. Then also sometimes be alert of your surrounding. Listen, look around, not just looking, but be alert, because sometimes the examiners will want to give you hints, like tilt you or guide you in the right path. So don't just cram and come and pour. You should know what's expected. You can cram, but as you're pouring out, pour with direction. Don't pour out of point. Pour because you read the question, see what they want you to do, what the focus is, and then act accordingly. You understand? You can do this. Other people have gone before you and they made it. You too can. Okay? So that's that about this series, at least for now. I hope you enjoyed it. I hope you're able to also get 1 or 2 things from it. I hope you found this helpful, and it covered up at least a lot of details about the exam. If you have any questions, please feel free to this sounds like a counseling session. If you have any questions, please feel free to write it in the comment section below, or you can contact me via email. My email is in the description box, so that you can ask, and as much as I can give information, I'll be happy and glad to give information to help. So I wish you the best in your preparations. You can do this. Be confident, but don't be overconfident. But become confident. You're already a doctor. You're just trying to get a license to practice in Nigeria. So don't feel intimidated. Just give it your best shot and leave the rest. And pray, my dear. You can overemphasize prayer. Pray like everything depends on prayers, and study like everything depends on studying. It will all end up in praise, and it will all work together for good. So thank you once again. It's been beautiful doing this. I hope you enjoyed it also. So stay happy, stay blessed, and I'll see you in the next vlog. Just before I go, let's just say prayer. Father, I thank you for the success of this video and this talk with the viewers. Lord, I pray that you will help everyone who's preparing for this exam, that you help them to do the things they need to do, cover what they need to cover, and grant them good success. We thank you, and this we pray and ask in Jesus' name. Amen. So thank you so much. Till next time, I am Dearie. In case if you don't know what MDCN is, it's it's Medical Dental Council. Dental Council. It is Medical and Dental Council of Council. It's the Medical and Dental Council of Nigeria. Hello Cherrie, welcome back to another episode on this channel. I hope you're all doing well. I hope this meets you all well, and then I'm happy to be here. So